this Women's Month. How can Filipinas take care of their health better, from pregnancies to something as simple as hair care? Those tips from OB Gynecologist, Dr. Corazon de Jesus. Doc, thank you so much for joining us on The Final Word. How important is it for women to have their general checkup?
Hi, good evening. Good evening, Rico, and good evening to everyone. This is a very important aspect in women's life, having a general checkup. But I just want to tell you that not many women come for their general checkup. So I want to take this opportunity to make them aware that a general checkup is very important because, as we say, prevention is better than treating. And going to your doctor for a checkup in those times when we don't have any symptoms at all, then it can save lives. It can even prevent us from suffering serious illnesses. And so I want to extend the message to make our women folk aware that they don't need to come to the doctor only when they have symptoms like unusual discharges or an irregular shedding of blood in between their cycles. Those are the reasons that they come to the doctor.
So doctor,
I want to,
why don't many women have their general checkup? Is it because of fear? Is it because they don't feel anything? They don't feel any symptoms?
Well, the most common reason why our women folks, especially the reproductive age group, these women who are in their 20s to their 35 to 40s, these are the women who are so busy, first preparing for a career, starting a family life, and starting motherhood. It's not actually fear, but it is more of not having the time to give themselves the chance to go to a doctor for a routine gynecological checkup.
So what should be on their screening checklist, doctor, during a routine general checkup?
So let me just try to divide the phases of women, because these checkups usually are less common in the reproductive age group. Okay, so this reproductive age group, as I said, is 20 to 35 to 40 years old women must be cognizant to the fact that they have to come for a checkup at least 2 to 3 years, even if they don't feel anything, because that's one of the most important screening that we have to take in these women is, the pap smear.
Yes.
This screening test is very important for them to prevent cervical cancer. Okay, so as I said, going to the doctor for a checkup will not only prevent disease, but it could save life, because the cervical cancer is a cancer that we can prevent by doing a regular pap smear. So, most of the time, Rico, when we see patients, I have lots of patients who are like that. So they come to me for a problem like unusual vaginal discharge.
Right.
And they come to me to say, Doc, gusto kong magpa-pap smear. When I ask them, when was the last time you had your pap smear? Matagal na po, Doc. O bakit ngayon ka lang nagpunta? Kasi, Doc, walang time. At saka po ngayon, meron po akong nararamdaman. So, in other words, they thought that the pap smear is a way of treating. It's actually not a treatment. Pap smear is actually a screening test that we start when we are 25 years old.
Doc, I'd like to jump in here. What about other screening tests like mammogram, blood sugar, blood pressure, fatty liver? Are these also essential for women to include in their on their list when they have their checkup?
Okay, when we get a general checkup that includes everything like that, then they can have a battery of tests. But then sometimes these are age appropriate. Okay, so if if our reproductive age woman comes to us for a general checkup without anything at all and just want to be able to pick up, then we give a battery of tests from the screening for anemia, screening for blood sugar, screening for cholesterol. But most of the time, our reproductive age women, they don't come to us for that. We catch them when they come for their first prenatal checkup.
Okay.
And then during this prenatal checkup, we are very thorough, or even before their prenatal checkups, when they come for a preconceptional checkup, we are very thorough in taking their blood pressure, their weight. They must be at their ideal body weight. We screen them for diabetes.
Yes,
We
Doc.
screen them for other tests like hepatitis, sexually transmitted diseases, as well as HIV.
All right.
So if the pap smear has not been done during the previous years, then we also do that.
All right, Doc.
So cholesterols and lipids, we don't. But then again, when they come to at least when they turn 35 or in the early 40s, especially when they have a history of breast cancer in the family, we tell them that they have to start screening for breast cancer at
All
the
right.
age of 35 or
Doc,
37, especially if the family history presented was or is a first degree relative, mother or a sibling, a sister.
Doc,
So then we
Doctor?
start early
Doctor?
in screening them.
Doctor,
Yes?
thank you so much for your medical checkup advice and for joining us on The Final Word. OB gynecologist Dr. Corazon de Jesus. And you can get more health tips on MedTalk Health Talk, hosted by Dr. Freddy Gomez, with new episodes every Tuesday at 3:30 in the afternoon.